procedure and nursing care plan.
Gather all the equipment. Inert stethoscope, tape measure, hand sanitizing gels, and draw sheets.
My name is Erica Joyce, your student nurse for today. And now we will be having a antenatal abdominal examination, Leopold'S Maneuver, and also auscultation of fetal heart rate. Is that okay? Mom, you want to go to the restroom first? Okay. If yung patient natin is okay naman na, then we can proceed to our next procedure, which is provide privacy to our patient by closing the curtains around the bed. Then, perform hand hygiene using the sanitizing gel. Then, position the woman for examination. Place a woman in a dorsal recumbent position, supine with knees flexed. Mamahat lang po natin to. Other side. Then, place a pillow under the head of our patient to have a comfort. Ma'am. Place a small pillow or folded towel under the women's right hips. Ma'am, natin. Then, have her arms by her side. Drape the women with a draw sheets. Then, pose her abdomen from below the breast to the symphysis pubis. Angat. Then, symphysis pubis. Kailangan naka-expose yung abdomen ng patient natin. Inspect abdomen for the following, which is scars, diastasis reti, hernia, linea nigra, stria gravidarum, contour of the abdomen, and state of umbilicus and skin condition. Then, determine the fundal height using the ulnar side of the palm. Then, measure the fundal height using a measuring tape. Next is measuring the fundal height using the tape measure. Place the zero of the centimeter into the superior border of the symphysis pubis to the top of the abdomen fundus along the midline, which is 32. 32 centimeter, which is equivalent to 32 weeks of being pregnant. Instruct the woman to relax her abdominal masses by bending her knees slightly and do relaxation breathing. Ma'am, inhale. Exhale. Then, warm hands by rubbing both palmar surface of your hand to produce a friction. Rest your hand on the women's abdomen slightly. Use flat palmar surface of fingers and do not fingertips during the palpation. And keep finger hands together. Kailangan dikit-dikit siya, and then yung palm, yung ipapang-palpate natin sa abdomen ng patient natin. Smooth and gently deep pressure as firm as necessary. Performing the first Leopold'S Maneuver. Stand on the women bedside and face the women. Palpate the fundus using the both hands. Curve the fingers around the top of the uterus and feel for the fetal part lying in the fundus. Use the palm palpate for the size, shape, and consistency and mobility of the fetal part in the fundus. Performing the second Leopold'S Maneuver is place your hands on either side of the women's abdomen about midway between symphysis pubis and the fundus. Ilalagay lang natin sa gilid ng abdomen yung both side ng arms natin. Then, move your hands to the side of the abdomen. With one hand, place in the steady of the uterus and use another hand to palpate the opposite side of the uterus with firm circular motions. Then, other side, circular, circular, circular. Forming the third Leopold'S Maneuvers or Paulik's grip. Continue facing the woman. Grasp the position to the lower abdomen, middle finger, and one of your hands. Which is, gagawa tayo ng L. Then, ilalagay natin sa malapit sa symphysis pubis. Then, titignan natin if yung baby ba is nag-engage or hindi. In case dito, is naka-engage na siya. We will be having a fourth maneuver. Then, place to the feet of our patient and to the abdomen. Place the palmar surface of your hands on the each side of the women's abdomen. Use both hands and palpate fetal head using pressure downward gently with your fingertips about 2 inches and above the inguinal ligament. If the hands converge around the presenting part, the head is not engaged. If the presenting part is engaged, there will be no mobility. This is indicative that the head of the baby is engaged. Then omit the fourth maneuvers if fetus in breech presentation. Note that this maneuver is performed only in cephalic presentation. And now we will be having a fetal auscultation using the Pinard stethoscope. We will use the bell side of the stethoscope, then place to the Pinard over the convex portion of the fetus closest to the anterior uterine wall. Listen by pressing firmly and very gently and count a full minute without holding the Pinard while other hand feel the mother's radial pulse. We will do it in a 1 full minute. ID the woman's unit. Then, ipa-place na natin in a comfortable position yung patient natin. Privacy. Then, wash hands. And document findings. That's all. Thank you.